Hello everybody, we are Haley, Alexis, and Chloe, and we are here to teach you about emphysema.
Emphysema is what occurs when the alveoli of the lungs become damaged, which causes the lining of the lungs to become weakened and damaged. There is no exact date for when emphysema was discovered. However, Hippocrates is usually given some credit because he discovered asthma during the early Greek times. Between the years of 1793 and 1807, Matthew Bailly documented emphysema by taking pictures of the lungs on the corpse in the anatomy lab he inherited from his father. In 1821, Dr. Lennox discovered the connection between emphysema and bronchitis. And in 1933, Ronald Christie was a part of a study that showed that the lost elasticity in the lungs caused an airflow limitation in the body. Mortality rate for emphysema is 7,455 deaths. That is 2.3 deaths for every 100,000 people. The morbidity rate is 3.5 million adults who have ever been diagnosed, and the prevalence is 13 per every 1,000. The incidence rate is 24% in both sexes, and some contributing risk factors are smoking, age, exposure to secondhand smoke, exposure to fumes or dust, and exposure to indoor and outdoor pollution. This chart is given to us by the NIH. This is the North Carolina data for emphysema. We can see a decline from 1980 into the early 2000s. The pathogenesis of emphysema is smoking, environmental factors, and alpha-1 antitrypsin.
Diagnosis is ascertained through signs and symptoms. The most common include shortness of breath, wheezing, cough that doesn't go away, and tightness in the chest. Your doctor will take a complete social and medical history and order imaging like a CT scan or chest x-ray. Lab tests include arterial blood gases and, most importantly, lung function tests. These measure how much air your lungs can hold, how well the air flows in and out, and delivers oxygen to your bloodstream. Emphysema can't be cured, but medications are used to relieve coughing, shortness of breath, and to decrease inflammation and mucus production. Vaccination should be administered for both pneumococcal pneumonia and influenza. Other therapies focus on education, breathing strategies, and supplemental oxygen if needed. The National Emphysema Treatment Trial found that people with upper lobe emphysema and low exercise capacity were likely to live longer and function better after surgery than with medication. Lung transplants are not typical, but they may also be an option for qualified candidates. Emerging treatments are focused on stem cells, drugs to slow or reverse the condition, and improving surgical procedures.
The number one cause of emphysema is smoking. Smoking cessation programs are a great way to reduce the likelihood of suffering from emphysema. Never let respiratory infections go untreated because they can cause permanent damage to your lungs. Always wear a mask when you're exposed to chemical fumes. Regular physical activity is also important because it can improve your lung capacity. The American Lung Association has a nationwide program called the Better Breathers Clubs. Their goal is to provide a support system for those with emphysema or COPD and for those who are at risk. They provide education and advocacy. Then we have the National Lung Health Education Program. They focus on awareness, education, and early diagnosis of the disease. Their main goal is to reduce the social and economic impact of COPD and emphysema. Healthy People 2020 have 4 objectives focusing on reducing the complications and hospitalizations due to COPD and emphysema.